Welcome to my channel. Today's physiology is tomorrow's medicine. Dear students, we are going to crack one more MCQ in this video. So the question is, the achalasia cardia is characterized by which of the following physiological abnormalities? Option A is loss of excitatory cholinergic neurons in R-Bucks plexus. Option B is loss of inhibitory nitrogen neurons in R-Bucks plexus. Option C is hyperactivity of vagal excitatory fibers. And option D is increased secretion of VIP and NO, that is vasoactive intestinal polypeptide and nitric oxide from myenteric plexus. First, we will see in detail what is achalasia cardia. Achalasia is a Greek word which means A means absence and chalasis is relaxation. That is literally means failure to relax or absence of relaxation. Cardia means it is a region of stomach where it joins the esophagus. So in this picture it is very clear that this is the cardia region of the stomach where the lower end of the esophagus comes and joins the stomach. So, as literal meaning of achalasia cardia is nothing but the lower esophageal sphincter fails to relax. So first we will see in detail about the layers of GIT. So as we all know, there are 4 layers in the GIT starting from inside. First is mucosa, second one is submucosa, and third one is muscularis layer, and fourth one is serosa layer. So these are the 4 layers of the GI tract, followed by what are the nerve plexus which are present in the GIT. When you see, there are 2 nerve plexus which is present in the GIT. One is the Meesner's plexus and another one is the Auerbach plexus. So the Auerbach plexus is present in the muscular layer and the Meesner's plexus is present in the submucosal layer. So this is also called as submucosal plexus or Meesner's plexus. This is called as Auerbach plexus or myenteric plexus. So we are going to see in detail about this Auerbach plexus in the coming slides. So what is the main function of myenteric plexus is it initiates and coordinates the contractions and relaxation of the smooth muscles, that is which is responsible for the propelling of the food through the digestive tract. So this is the main function of the myenteric plexus. In myenteric plexus we have excitatory motor neurons which release acetylcholine, inhibitory neurons which release nitric oxide and vasoactive intestinal polypeptide to muscle to cause muscle contractions and relaxations respectively, which means acetylcholine causes muscle contraction and nitric oxide and VIP causes muscle relaxation. So this is the neurons which are present in the myenteric plexus. So from this slide it is very evident that myenteric plexus is necessary for the rhythmic contraction of the smooth muscles in the gut. So coming to the pathophysiology of achalasia cardia, mainly the genetics, infection or autoimmunity, whichever may be the cause, it can lead to the deficiency of myenteric or Auerbach's plexus. So it leads to specific deficiency of nitrogen neuron, that is which secretes nitric oxide and also VIP. So there will be imbalance between nitric oxide and acetylcholine. So because of this, relaxation is lost, this lower esophageal sphincter fails to relax, so the resting tone become high. So to reinforce this, so whenever there is a normal esophagus, because of any immune mediated inflammation or it may be a genetics or it may be infection, there will be loss of inhibitory innervation mediated via the nitric oxide. So what will happen to this? Because of this, the esophagus will end up in early achalasia. So the abnormal peristalsis will occur and there will be abnormal lower esophageal sphincter relaxation occurs. So the main pathophysiology is deficiency of nitric oxide and also vasoactive intestinal polypeptide. So this is a picture to compare the healthy esophagus and achalasia cardia. So when you see in the healthy esophagus, the LES is normal here. So whenever a food bolus comes due to the peristalsis, it will easily enter the stomach because of the relaxation of LES. But what happens in achalasia cardia, because of the resting high tone of the LES, the lower esophageal sphincter does not relax. which will lead to accumulation of the food in the lower end of the esophagus, and gradually the lower end of the esophagus will go for dilatation, and this will lead to further complication of the achalasia cardia. This is one more picture to show the achalasia cardia normal esophagus. If you see in the normal esophagus, at rest the sphincter will be closed. That is, the lower end esophageal sphincter is closed. But during the food entry, it has to be opened. This is normally occurring in normal esophagus. What happens in achalasia? At rest is the sphincter is closed, and also during the swallowing or when the food reaches, the sphincter fails to open properly. So the basic pathophysiology here is the failure of relaxation of the lower esophageal sphincter. So because of the lower esophageal sphincter fails to relax, what are the clinical features that the people may experience are, because of the food or in the lower part of the esophagus, they may experience heartburn, chest pain, and because of the more accumulation of the food, they may lead to vomiting, burping, and they will also have the dysphagia. And sometimes what will happen, because the food can be aspirated into lungs and can cause pneumonia, and also because of the food is not properly entering into the stomach, they will also experience weight loss. So coming to the investigation of achalasia cardia, first previously what was used is barium well X-ray. In barium well X-ray, when barium well was given and taken X-ray, it is will be shown like this. This is the esophagus, which is showing the smooth tapering of the lower end of esophagus, which is looking like a beak of a bird. So this sign is called as bird beak appearance of esophagus, which is characteristic of achalasia cardia. So the next investigation is esophagoscopy. So the esophagoscopy is a scopic procedure which is used to endoscopic procedure which is used to view the lower end of the esophagus. Mainly it is done to rule out the esophageal carcinoma. Esophagoscopy is followed by esophageal manometry. Manometry is going to measure the pressure in the esophagus from along the pharynx to the lower esophageal sphincter, and this esophageal manometry is the gold standard test for diagnosing achalasia cardia. Once we have diagnosed the achalasia cardia, the treatment part includes: first one is mechanical pneumatic dilatation of the sphincter, second one is myotomy, and third one is botulinum toxin. First we will see about the mechanical pneumatic dilatation of the sphincter. If you see here, the lower part of the esophagus, they will introduce a balloon, and through the air, they will dilate the sphincter. This is one of the procedure to dilate the lower esophageal sphincter. The second one is a surgical procedure. This is called as Heller myotomy, and what they will do is they will split the muscle here, and they will do the fundus of the stomach is wrap over it. This is called as Heller myotomy and fundoplication. Finally, recent advance in the treatment is botulinum toxin. The botulinum toxin is injected at the lower esophageal sphincter. This botulinum toxin will cause degeneration of the acetylcholine neurons, so the resting tone of the LES will become less. So these are all the three treatment modality for achalasia cardia. So coming back to the question, the achalasia cardia is characterized by which of the following physiological abnormalities? From this, the option A is loss of excitatory cholinergic neuron. We know that this is loss of inhibitory neurons. So option B is loss of inhibitory nitrogen neurons. So the option B is correct, and option C is wrong because it is showing that hyperactivity of vagal excitatory fibers. And option D is also wrong because there will be decreased secretion of VAP and NO from myotic plexus. So the answer is the loss of inhibitory nitrogen neurons in Arbuck's plexus. So not only one MCQ I am going to discuss here, I am going to discuss 2 or 3 more MCQs based on this chapter. So the next question is the classic barium swallow finding in achalasia cardia is, which is the appearance. So the answer is bird beak appearance. The next question is, a 45-year-old man with suspected achalasia cardia undergoes investigations. Barium swallow suggests bird beaking narrowing. So endoscopy is performed to rule out carcinoma. Which investigation is most sensitive to confirm achalasia? We all know that the investigation is first is barium swallow, followed by endoscopy, and then which is followed by manometry. So the correct option here is manometry. Finally, when a 30-year-old man with achalasia cardia is treated with botulinum toxin, after the procedure he develops temporary relief. What is the mechanism of action? As we all know, this blocks acetylcholine release at NMJ and reduces the LAS contraction. So the option is option B. So we came to the end of the video presentation. All the best, and kindly subscribe my channel for further videos. You can suggest also topics to be discussed in the comment section. Thank you.